think
Let me ask
any country
Dr.
would allow
Brito,
that to
because
be administered.
abroad in the US and in the UK, the Pfizer vaccine is already being administered to younger adults between 12 and 18. I think Moderna has also applied for emergency use for the younger population. So, what is it that sets apart those vaccines from the ones that we have here in India? Is it that the mRNA technology enables you to give these vaccines to younger adults in a safer manner than the other vaccines that we have?
Zaka, thank you. Uh, Zaka, let's step back for a moment. What are we trying to achieve in children when we vaccinate children? What we're trying to do is not just establish safety, but we're also trying to establish how effective is this vaccine, not just in preventing severity of illness or hospitalization and death, but crucially in children, we're trying to decrease transmission. So any vaccine that's introduced in children, and therein lies the difference, you mentioned the messenger RNA vaccine, we need to see how effective these vaccines are in decreasing transmission, because as we've discussed before, Zaka, the burden of disease in children is much lower than it is in adults. US data, sadly there isn't Indian data available, but US data suggests that just 3% of positive cases in children require hospitalization, and the mortality rate is 0.03. So when we start vaccinating healthy children, bearing in mind the low burden of disease, the only reason we're vaccinating them is not to prevent severe disease, hospitalization, and death, but to decrease transmission. Then we can open our schools. Until the transmission rate drops, as long as there's transmission in the population, there's going to be mutation, and some mutations may be gain of function mutations, which could be increasingly virulent, increasing transmission, and increasing escape from immunity. So my own view, the short answer is, where our children are concerned, Zaka, we should be seeking full approval of vaccines, not emergency use authorization, but full approval before we start vaccinating our children.
No,